Hi, my name's Merfield. I'm a rural GP in Dover in southern Tasmania. My first experience of telehealth was in Antarctica, where we used it pretty much all the time, getting advice from specialists and doctors back at the Polar Medicine Unit. So I'd had a fair bit idea of how well it could work prior to coming to Dover. Since then I've been involved with the telehealth project through the Royal Hobart Hospital, trying to really push it along for patients in this area where it's been so helpful. We've certainly had patients who have really benefited, and I'm particularly thinking of examples where, for example, I have a patient who's a severe diabetic who has eye problems, renal problems, foot problems, heart problems, and has numerous appointments at the Royal Hobart Hospital. In any one week he might have 2 or 3 appointments. Transport is a huge issue, but he can't drive because of his visual problems, so he relies on other people to transport him to and from hospital appointments. So having telehealth for him has really made a huge difference to him not having to spend his entire day going to Hobart and back with the transport issues, which absolutely exhausts him by the end of the day. So the telehealth where he can come here, we're also able to talk to the specialist, and our practice nurse can be involved as well. Makes it much better care for the patient, and I think communication between the GP such as myself and the specialist is hugely improved as well. So I think it's been a fantastic thing, and I'd really like to see it continue.